Did you know that thyroid disorders affect millions of people worldwide? From hyperthyroidism to hypothyroidism, these conditions can have a significant impact on your health and well-being. In this video, we'll break down each disorder and its symptoms. This is the first video in the thyroid video series, where we will be discussing the importance and functions of the thyroid gland, along with a few common disorders. Welcome to Meducatives. This is the official YouTube channel of www.meducatives.com. We believe that awareness is everything, and our goal is to promote it. Introduction. The thyroid gland is a small, butterfly-shaped gland located in the neck, just below the Adam's apple. It produces hormones that regulate the body's metabolism, which is the process by which the body converts food into energy. The thyroid gland produces two primary hormones, thyroxine, T4, and triiodothyronine, T3. These hormones are made from iodine and the amino acid tyrosine, and they are released into the bloodstream and transported throughout the body. Functions of the thyroid gland. Metabolism. The thyroid gland produces hormones that are essential for regulating metabolism, which is the process by which the body converts food into energy. Thyroid hormones help to regulate the rate at which the body uses oxygen and nutrients from food to produce energy. They also play a role in maintaining a healthy weight, as they can affect the rate at which the body burns calories. Growth and development. Thyroid hormones are critical for proper growth and development, particularly in children. They are involved in the development of the brain and nervous system, as well as the development of bones and muscles. Thyroid hormones also play a role in the maturation of reproductive organs. Body temperature. Thyroid hormones help to regulate body temperature by increasing heat production in the body. This helps to maintain a stable body temperature, even in changing environments. Heart rate. Thyroid hormones can affect heart rate and rhythm by increasing the rate at which the heart beats. This can have an impact on blood pressure and overall cardiovascular health. Digestion. Thyroid hormones can affect digestion by regulating the speed at which food moves through the digestive system. They can also affect the absorption of nutrients from food. Reproduction. Thyroid hormones play a role in fertility and reproductive health in both men and women. In women, thyroid disorders can cause menstrual irregularities, difficulty getting pregnant, and complications during pregnancy. In men, thyroid disorders can affect sperm quality and fertility. Overall, the thyroid gland and its hormones play a vital role in many bodily functions, and it's important to keep the thyroid gland healthy to ensure optimal overall health and well-being. Thyroid disorders. Hypothyroidism. Definition and causes. Hypothyroidism is a condition where the thyroid gland doesn't produce enough thyroid hormones. Thyroid hormones play an essential role in regulating metabolism, which affects almost every organ and system in the body. Hypothyroidism can be caused by a variety of factors, including autoimmune disorders, such as Hashimoto's thyroiditis, which damage the thyroid gland; iodine deficiency, which is rare in developed countries but still a problem in some areas of the world; radiation therapy, which can damage or destroy the thyroid gland; thyroid surgery, where a portion or all of the thyroid gland is removed; congenital hypothyroidism, where the baby is born without a thyroid gland or with a poorly functioning thyroid gland. Symptoms. The symptoms of hypothyroidism can vary from person to person and can be subtle or severe. They usually develop slowly over time and can be mistaken for other conditions. Common symptoms of hypothyroidism include fatigue, weight gain, cold intolerance, constipation, dry skin and hair, muscle and joint pain, depression, memory problems. It's important to note that these symptoms can also be caused by other conditions, and not everyone with hypothyroidism will experience all of these symptoms. If you are experiencing any of these symptoms, it's important to talk to your doctor to determine the underlying cause and develop an appropriate treatment plan. Diagnosis. Hypothyroidism is usually diagnosed through a blood test that measures the levels of thyroid-stimulating hormone, TSH, and thyroid hormones, T3 and T4, in the blood. If TSH levels are high and T3 and T4 levels are low, this may indicate hypothyroidism. Other tests, such as a thyroid ultrasound or a radioactive iodine uptake test, may also be done to help diagnose hypothyroidism and determine its underlying cause. Treatment options. Hypothyroidism is usually treated with thyroid hormone replacement therapy. The goal of treatment is to replace the missing thyroid hormone and restore normal levels of thyroid hormone in the blood. Treatment options include levothyroxine, Synthroid. This is the most common medication used to treat hypothyroidism. It is a synthetic form of the hormone thyroxine, T4, and is taken orally once a day. The dose is adjusted based on blood tests and symptoms, and it may take several weeks or months to achieve the correct dose. Combination therapy. Some people may benefit from a combination of levothyroxine and liothyronine, Cytomel, which is a synthetic form of the hormone triiodothyronine, T3. This may be used in certain cases where levothyroxine alone is not providing adequate symptom relief. Dietary changes. Iodine is a key nutrient for the production of thyroid hormones, and people with hypothyroidism caused by iodine deficiency may benefit from increasing their intake of iodine-rich foods, such as seafood and dairy products. Lifestyle changes. Regular exercise, stress reduction techniques, and adequate sleep may also help manage hypothyroidism symptoms. Hyperthyroidism. Definition and causes. Hyperthyroidism is a condition in which the thyroid gland produces too much thyroid hormone. This can be caused by a variety of factors, including an autoimmune disorder called Graves' disease, which causes the immune system to attack the thyroid gland and stimulate excessive hormone production. Other causes include thyroid nodules or inflammation, or the use of certain medications or supplements that affect thyroid function. Symptoms. The symptoms of hyperthyroidism can vary, but may include weight loss despite increased appetite, rapid or irregular heartbeat, sweating or sensitivity to heat, anxiety or nervousness, tremors or muscle weakness, difficulty sleeping or insomnia, frequent bowel movements or diarrhea, fatigue or weakness, changes in menstrual cycles. Diagnosis. Hyperthyroidism is usually diagnosed through a blood test that measures the levels of thyroid-stimulating hormone, TSH, and thyroid hormones, T3 and T4, in the blood. If TSH levels are low and T3 and T4 levels are high, this may indicate hyperthyroidism. Other tests, such as a thyroid ultrasound or a radioactive iodine uptake test, may also be done to help diagnose hyperthyroidism and determine its underlying cause. Treatment options. The treatment of hyperthyroidism depends on the underlying cause and severity of the condition. Treatment options include antithyroid medications. These medications, such as methimazole or propylthiouracil, work by blocking the production of thyroid hormones. They are usually taken orally and may be used to manage symptoms while the underlying cause is being addressed. Radioactive iodine therapy. This treatment involves the ingestion of radioactive iodine, which destroys thyroid cells and reduces hormone production. This treatment is often used in cases of Graves' disease or nodular hyperthyroidism. Surgery. In some cases, surgery may be necessary to remove all or part of the thyroid gland. This is usually reserved for cases where other treatments are not effective or are not appropriate. Beta blockers. These medications can help manage symptoms such as rapid heartbeat, tremors, and anxiety. It's important to work closely with a healthcare provider to determine the best treatment plan for hyperthyroidism, as the optimal course of treatment can vary from person to person. Regular monitoring of thyroid hormone levels and symptoms is necessary to ensure that treatment is effective and appropriate. Thanks for watching. Please visit our website www.meducatives.com. You may like our free ebooks and medical and health educational products on our website. If you enjoyed the video, please consider subscribing, sharing, liking, commenting, and pressing the bell icon to receive notifications for more content like this. Lastly, don't forget to follow us on Instagram, Facebook, and Twitter.